Hi y'all, this is Bree. I am here in Verde Valley Medical Center in Cottonwood, Arizona. And what I have here, as you can see in the picture, is called the LikoRall 250. And what this presentation is on is using this system for safe patient handling and transfers, and the many uses and different materials we use with it. It not only will help your patient, but it will also help you to prevent back injuries and help you sustain your long-term career. So our first thing is called the repo sheet, and what it is for those patients that are completely dependent with transfers and mobility. They have these tassels that run along the edges on both sides of the sheet, and it acts as a fitted sheet on the bed, and so the patient can lay directly on it, and they are washable, so we can reuse them. We wash them here in the hospital. So now I'm going to go through, attach each of those tassels on each side of the repo sheet to the LikoRall 250, and that way I'll be able to lift this patient up, either transfer him to the bedside chair, or say this patient, you found him in his room and he was just jammed at the bottom of the bed. You can use that to lift the patient up and to the top of the bed and lower him back down. Another way to use the repo sheet is for those patients that require quarterly turns. And so here I have the other side of the bed rail up to prevent the patient from rolling over off the bed. And I attach each of the tassels on one side of the repo sheet to lift him up. And then you can stuff pillows underneath the patient, release it, and then he is essentially side-lying. And then you can come back in 2 hours later and you can reposition him the other way. The next thing we have here is the multi-purpose strap. For PT, we like to use this a lot for wound care. Say the patient has a pressure sore that needs to be looked at, say on their ischial tuberosity or sacrum area. And so we place this underneath the patient's leg and attach it to the LikoRall to lift the patient's leg so we have better access to that area. Or say the nurses like to use this as well to get better access as if they were putting in a catheter. There's this other strap where we can attach it to the bed to help plant the LikoRall in place so it doesn't move around when you're trying to work on the patient down there. And the benefit of the multi-purpose strap is so that you don't have to worry about holding up the leg while you're trying to work down there for an extended amount of time. Now the next on our plate is called the high sling back. This is essentially very similar to the mechanical Hoyer lift that we learned in school. However, this is so much easier. You can hook it up to the LikoRall, and then you can transfer to the patient to the bedside chair, or also the patient will have access below so you can transfer them to the commode and not have to worry about getting a mess on the sling, and they can use the restroom. And then there has the straps, so you can lift the straps up so the patient can be more sitting 90-90 in a chair. And then you can lower them back down. Next up is the master vest. And I'll hook this up around Logan here and attach it through the back with the straps and onto the LikoRall 250. And this is for those patients that you're just not entirely sure how safe they are with their mobility and transfers. But they're strong enough to possibly walk. And so with the LikoRall, we look at it in the master vest, we look at it as possibly a strong enough, bigger gait belt. So if the patient does fall, then they will be caught. Next up is very similar to the master vest. However, these are called the lift pants. And so I'm going to hook these up on Logan. It basically looks like a giant diaper. And this is for more of those patients that say they had a CVA or are a little more dependent and can't get up on their own, but we still want to work on their gait and endurance, and so these are great use for that. There is also other sizes in here where if the patient was more a much larger patient, then we have other slings to fit those patients. So now Logan will stand up and he will be safe to walk around the room. Or next up, I'm going to show you our 75-foot track. This is the 75-foot track. It is in a new unit in the hospital, so it is vacant until next month. It should open. But this was very helpful with my patient specifically because while in the ICU, he had very great troubles trying to navigate around the room. It was very cumbersome for him trying to do turns. So what I did, I transferred him to a wheelchair and wheeled him down to this track. So then once we were hooked up on the track, he was able to walk the entire 75 feet and then all the way back. And if he fell, then he was safe. But he did such a wonderful job on the track and was able to use an assisted device and to help build his endurance and confidence in his walking. This is to conclude the entire presentation. As mentioned before, there are multiple sizes for the equipment that we use today, from extra small to extra large. And the main purpose for this presentation was to show different ways for safe patient handling. This will help prevent those injuries and falls of patients, and to even help build the patient's endurance and confidence in activities that you don't think you could have done without this system. And also, more importantly, for ourselves, to help prevent any sort of back injuries or to help prolong our life through this fulfilling career. And so that's a wrap. Thank you for listening.